Hi! Tinea Pedis, the ultimate guide. What is it? Tinea pedis, more commonly known as athlete's foot, is a dermatophyte infection of the soles of the feet and its interdigital spaces. First reported in 1908 by Arthur Whitfield, who was a dermatologist at the King's Cross Hospital in London. Tinea pedis has since then become endemic to first world countries around the globe, inadvertently supported by our modern lifestyles and hygiene practices, and along with our tendency to frequently wear socks and occlusive footwear. The rate of Tinea pedis has increased and spread as a result of keeping our feet in moist and warm conditions. Along with those living in tropical and humid countries, Tinea is also prevalent in those who regularly play sports. The condition is contagious and can be transferred either through direct physical contact or by coming into contact with areas that the fungus can survive in, such as swimming pools, locker rooms, and public showers. It is vital to know the characteristics, symptoms, and signs of tinea, as it will aid in the diagnosis of the condition. Given its prevalence, it is advised to many of the general population who either have the infection or are free of it to have some basic knowledge of tinea. Signs and symptoms. Tinea pedis has four common presentations: interdigital, chronic hyperkeratotic, ulcerative, and inflammatory vesicular tinea pedis, all of which have varying and in some cases similar characteristics and appearances. Being the most prevalent and common form of tinea, interdigital tinea is quite different from the other three, as it only occurs between the digits of the feet, more commonly between the fourth and fifth digits. The characteristics of interdigital tinea include a combination of erythema, which is redness, maceration, fissuring, and scaling, along with regular shedding of skin on the plantar surface of the foot. The dorsal surface of the foot is usually free of fungus, but some infection may extend onto it. Next is chronic hyperkeratotic tinea. It is characterized by chronic plantar erythema on the plantar surface covered with hyperkeratotic scales. Acute ulcerative tinea, usually accompanied by a secondary bacterial infection, is characterized by ulcers and erosions in web spaces, and typically shedding of large areas of the sole of the foot is common. As infection progresses over time, a secondary bacterial infection is more susceptible to occur as more prominent lesions and cracks form. These prominent lesions and cracks of the skin provide a leeway for other infections to grow either in the nails or deep to the skin. Inflammatory of vesiculobulus tinea pedis is the least common and mostly occurs in the instep and consists of itchy blisters and lesions of either clear or purulent fluid and erythematous scaling of the sole.
Diagnosis. A general practitioner, dermatologist if required, and a podiatrist are the health-related professionals usually required in the diagnosis. If the patient believes that they are encountering or experiencing the signs and symptoms of tinea pedis or another infection of the foot, seeking medical attention is required. As is the case for many a medical issue, the first point of call is and should be their general practitioner. The GP should then proceed to conducting a physical or visual examination of the infection and come to a conclusion. Provided the patient is exhibiting the correct signs of a specific foot infection, the GP will fulfill their duty and will diagnose the infection as tinea pedis or another infection of the foot. Tinea pedis is typically diagnosed by scraping the plantar of the foot and between the toes using a solution of potassium hydroxide to view the material under a microscope. This can confirm the presence of fungal culture and identifying the specific strain of fungus that is present. A diagnosis of tinea pedis should not prevent a patient from going about their daily activities. If the GP is not able to come to a concrete conclusion, they will then recommend and refer the patient to a dermatologist who can test, sample, and name the infection present on patient's foot. Using debriding techniques to obtain a skin sample, the dermatologist analyzes the sample and comes to an educated conclusion and prescribes the necessary medicine required to overturn the infection and to induce healing. Further, if the patient is having trouble managing or bearing the pain during day-to-day activities, a podiatrist is consulted to aid in the management of pain. Using their knowledge, the podiatrist will relieve pressure off the infection using patient-specific padding to offload the patient's weight.
Clinical cause and prognosis. As stated previously, the signs and symptoms of tinea pedis can vary for each individual. However, delaying a medical diagnosis could result in a growth of the infection, which could increase pain and discomfort in the individual. In addition to a clinical cause, a doctor will be able to identify the prognosis of the infection. The lifestyle of an individual could provide a likely prognosis for patients with tinea pedis. Gonst reported that communal showers, baths, and pools are all risk factors which increase the chances of acquiring tinea pedis due to the skin of the foot being exposed. The age of the patient is also another factor that could play a part in acquiring the infection. Tinea pedis usually occurs in young adult males. This could be due to the active lifestyle. Aggravating the infection will result in worsening it. Tinea pedis thrives on heat and moisture, therefore personal hygiene is crucial. Also, sharing of socks and shoes is another risk factor as well. Knowing the prognosis and clinical cause of the infection, the doctor then can prescribe necessary treatment options for the patient. Treatments. Once a doctor has diagnosed a patient with tinea pedis, the doctor needs to be able to allocate a clinical cause of the condition so that the patient will be able to receive the most useful treatment in eradicating the problem. As far as evidence-based treatment, the most common and useful treatment for tinea pedis are topical antifungals. Winston and Berman stated that the appropriate topical antifungal cream should be prescribed to patients with tinea pedis. It should be applied once to twice a day for about 2 weeks or several days after resolution of symptoms. Topical antifungal creams can be bought over the counter at pharmacies, with pharmacists recommending terbinafine as a more viable option for tinea pedis, as it has proven results in eradicating tinea pedis. However, tinea pedis thrives on warmth and moisture. Therefore, an individual can take up non-pharmacological measures, such as switching to socks with damp-resistant materials, such as cotton. Patients should also be noted of prevention methods, including thorough drying of the feet after contact with water, wearing appropriate footwear as well as regularly changing socks. Patients should avoid sharing footwear with others as it could spread the infection as well as obtain various infections from other individuals. Patients should also try and avoid places such as communal showers and public changing rooms, as these are the places that could obtain and spread the infection. If visiting such places, one should cover their feet to prevent obtaining such infections.
In summary, the prevalence of tinea pedis amongst the population showcases the importance of attentive care and management by patient and professional. Children should be advised from a young age of the symptoms and signs of tinea pedis, which include blisters and rashes of the foot, often accompanied by itchiness. To reduce chances of secondary infection, early detection is crucial. Due to the active lifestyle of individuals, tinea pedis is often contracted from direct exposure by walking barefoot. Therefore, acknowledgement of prognosis is pivotal in helping reduce cases of tinea pedis nationwide. This fungal infection, accelerated by warmth and moisture of the foot, should be counteracted by administering appropriate footwear, including socks and shoes, as well as regularly changing. A trip to the GP should be made if a symptom arises, so necessary measures can be taken by letting it be taken in the hands of relevant healthcare professionals, such as a podiatrist and or dermatologist, before it gets to a chronic stage.
These were the references we used for this presentation. The article Superficial Cutaneous Fungal Infection in Tropical Countries by Charles is really beneficial as it talks about tinea not only in the foot but all over the body. It could be really useful for parents whose children have tinea pedis. Due to the itchiness of the infection, children might have the tendency to scratch it and make it spreading to their hands. Thank you for listening to our presentation.